Introduction. Good morning, respected chairpersons, to deliver Dr. P.N. Bell's oration. So while preparing for this talk, which I had to put together in this talk, so some of them may look like fossils, kindly excuse me for it. The old dictum describes dermatology in the past as an ounce of Latin and a pound of Greece, highlighting the traditional focus on topical treatments and terminologies. It also says that the plastic surgeon redefines surgical techniques, physician redefines newer indication of old drugs, and dermatologist redefines nomenclature. But now dermatosurgery defies this statement. In fact, dermatosurgery has refined dermatology, and today dermatology is much about precision, innovation, and surgical skill. Now, coming to my journey, I started my medical journey at the prestigious Madras Medical College. It sparked my interest in procedures and rekindled my surgical desire. And I'm happy to share that my involvement in dermatosurgery has not only brought me personal fulfillment, but also has been professionally recognized today. Thank you, AXI. Most of you would know Professor Thambaya, who is a legend in dermatology, and his disciple, Professor Patrick Yasudian. I had the privilege of being taught hardcore clinics. Professor Kamalam, who taught me mycology, Professor Sendamal Selvi, and Professor Janaki, who have extended their support beyond professional life, positively influencing my personal life as well. I would also like to remember Dr. Rekha Sheth, who even in my early days encouraged me to deliver talks and asked me to conduct workshops at every CDS I meet. And I was also made the Vice President of Cosmetic Dermatology Society of India, 2006 to 2008. And it is during this period that we decided to change the name of CSI, Cosmetology Society of India, to Cosmetic Dermatology Society of India for obvious reasons. Now, how did I transition to dermatosurgery? I had joined government service to the corporate hospital, made me witness the increasing demand for aesthetic procedures and increased awareness among patients on advances in dermatology. My patients would tell me that they were going to Singapore, which was the closest place, and they would say they were going to Bangkok, and seized the opportunity to attend the skin therapy update in 1995, and then I attended a 1-week observership at the National Skin Center Singapore, because Professor Patrick had given me a letter of recommendation to Professor Go, and he allowed me to be an observer free to start with, and returned home with a bunch of neo-straight-up peels, and there's no looking back. Now, encouraged by the patient's acceptance for procedures, I pursued an observership course in dermatosurgery and hair transplant, as it is a dream of every young dermatologist even today. I did this at the Cleveland Clinic Foundation in 1999. And this is a group of the hair transplant team where I did my observation. That is Robert Haber, who was an amazing award-winning hair restoration surgeon. And these were the 3 hair transplant nurses, and that was the counselor. This formed the team. And this is one of the nurses who was slivering the grafts and placing it on a tray, and they were so beautiful, and they used it just with Persona blade and the blade holder and a very good microscope. I thought it was such an easy job to do, so I decided to replicate it here. And at Cleveland Clinic, I also found a lot of lasers, sclerotherapy, Mohs surgery, and injectables, which I had never seen in my life. And I managed to return with basic equipments like convent hyflicator, micropigmentation device, dermabrader, and some hair transplant instruments, which are working even now. And this is Dr. Wilma Bergfeld, if you are able to recognize. I attended her hair clinic, and I picked up a lot of important clues on treating hair disorders. And this is my first dermatosurgery book. In those days, we did not have dermatosurgery books, and we were not as lucky as the youngsters now. As Sir William Osler said, To study the phenomena of disease without books is to sail an uncharted sea, while to study books without patients is not to go to sea at all. And I decided to do both. And this book by Ronick and Ronick on principles and practice of observership, I was inspired, as I mentioned earlier. I thought hair transplant is so simple. I decided to expand my practice by incorporating hair transplants. Even though I had limited training, it was not hands-on training, it was just a visual training. And there were no resources. None of my nurses knew how to do sliver the grafts. Despite my enthusiasm, the initial results of these hair transplants were not as successful I thought it to be, and therefore I decided to focus my efforts on procedures where I could really unsuccessful hair transplant. And those days we did not have finasteride or dutasteride, just topical minoxidil. And these hair transplants I would do after 9 p.m. because I would finish my clinical OP, because I had to pay rent for my hours of time in the corporate hospital, and sometimes it would even go up to midnight because the nurses were not trained. That's a time when the general OT would be free and I could take the time as much as I needed. So with all this, I managed to do about 10 cases. Then I decided vitiligo surgery, which I found to be a soul satisfying job. And I happened to attend the live dermatology workshop at Balabai Nanavati Hospital by none other than Dr. Satish Sawant. And I started doing vitiligo surgery under the guidance of a plastic surgeon in my hospital. I did split skin grafts, punch grafts, and I even presented a paper on suction syringe technique for epidermal grafting at the 20th National Conference of IADWEL 2000 in Bangalore, 24 years ago. And these were the simple things that we used. I used the MR syringe, a glass syringe, and the simple rubber tubing. And this is all that I needed. Of course, now we have hijama cups. And sorry for the quality of the picture, I had to take it from my slide. And this is how we would place the syringes. And this is the graft that we would get. And this is one of the grafts which I'd used on this patient's lip vitiligo. And these were my vitiligo surgery equipments. It was a Humpy's knife, Watson's modification. This was a dermabrader kit that I had brought from there. And this was what was giving me the pleasure. And these are some of my cases. The case of mucosal vitiligo immediately post-op, and this was 1 year later. And these are some of my vitiligo cases where I did split skin graft. And this is a lady who was from Kerala. I'm sure Dr. Salim would have still been in college at that time. Otherwise, I would not have got cases from Kerala. And this was the results 2 years later. She used to come once a year for follow-up. And this was another young man who had segmental vitiligo, and that was the result after 2 sessions. And this is a young girl with vitiligo of the areola, and this is how I did the punch graft, and this is the result. Now, how did I transition to aesthetic practice? As I mentioned earlier, these cases used to be done either after 9 till midnight or had to be done during lunchtime because I did not want to miss out on my clinical dermatology. And during those days, the procedures were entirely different. They were very time consuming. And being a one-man army treating both clinical and surgical cases, it was very difficult for me. So I had, by then, injectables and energy-based devices had come in. So I decided to transition to injectables and energy-based devices because I could do them in my OPD and it was less time consuming and more remunerative. Mahatma Gandhi said, "Live as if you were to die learning, to stay updated. Learning is perpetual. Learning is a lifelong journey." I attended another chemical peel workshop at Princeton, New Jersey, where I learned a lot about neostrata peels. Then when injectables caught up, I decided to attend a cosmetic dermatology advanced course in London from a plastic surgeon in Harley Street. And mesotherapy, if you remember in those days, was a big no-no. In UK and USA, they said they would never ever do mesotherapy, but now it's all over the place. The other day, Dr. Jerry Shapiro said that he's very happy doing dutasteride mesotherapy because he was getting great results. So in those days, it was available only in the UAE and in Thailand. So I decided to go to UAE for training, clinical and theoretical training in mesotherapy. And recently, as all of you know, exosomes has been the buzzword. So I went to the Clear Skin Institute of Laser Aesthetics in Phoenix, Arizona in March 2022 and got trained in exosomes and microneedling radiofrequency. I know there's lots more for me to learn. And in 2013, I attended a workshop in Italy under Dr. Riccardo Forte, and I was stunned by this PRP kit as well as the delivery system, which I am yet to see one in India. Now, my interest in and involvement in dermatosurgery opened up professional opportunities as a speaker and chair in international conferences. I had the opportunity to chair a session at the 24th World Congress of Dermatology in Milan, and also recently in Singapore, where I had to speak on new insights into mesotherapy. It was my dream to speak at the American Academy of Dermatology, and there I had an opportunity to see tranexamic acid in the treatment of melasma, one on treatment of xanthelasma with 100% DCA, and one on treatment of vitiligo by needling with topical 5-fluorouracil. Now, being a one-man army and just a lone practice, and I was fortunate to get them published. I would thank Dr. Ashik for introducing me into publications. We all know that many interdigital dermatoses such as candidiasis intertrigo worsen when the area is moist, and the response to therapy is much better and the recovery time is shorter if the affected toe spaces are kept separated at least while at rest and when asleep. So initially I got them made out of years ago 200 to 300 rupees, but as the price of silver went up, I turned to in physicians when they are treating conditions in the interdigital spaces like cryotherapy or electrocautery and even for nail surgery. Now I have entrusted this work Derma India, and Derma India today has gifted me with 40 toe separators of 3 different sizes, and I wish to distribute them to colleagues and friends today, those who are interested in having them. So those interested, kindly contact me after this talk. Now, keeping hairs away during procedures can be cumbersome, especially in non-cooperative patients and children. But using an ultrasound or an ECG gel can actually make the hair stiffer and adhere to one another. And this technique can be used to keep the hair away from the field, and therefore the need of a hairband or an assistant can be bypassed. Now, ear and nose piercings have always been popular and will continue to remain as beauty trends or cultural practices. For this, we only have a ear piercing gun, or we have to use 2 needles, which is a little cumbersome. Here, we take a simple sterile hypodermic needle to fit the thickness of the earring or nose ring post. The needle hub is removed and we fit the earring or the nose ring post into the cut end of the needle, and we just give a single pierce. The cost is low and the procedure is sterile. Now, we know that idiopathic guttate hypomelanosis it is said that pesky warts do more harm to spoil the reputation of the dermatologist than any other condition, and so true. And most of the treatments for warts are partially successful and can have an increased rate of recurrence. And using an ultrasound gel can prolong the freeze time and maintain the temperature for a longer period of time, making it more effective. And this paper of mine was flashed twice at the AAD and under practice pearl sessions by Stephen Stone. So I felt really proud to see my paper being flashed at the American Academy. Now I must sincerely thank Dr. Jayashree for inviting me to be the co-editor of this book on aesthetic dermatology, and this is Professor CRS blessing us on the day of book release. Dr. Ganesh Pai and Dr. Srinivas have always been a source of constant inspiration. I cannot forget the session on coffee with Maya at Dermacon, suggested by Professor CRS, and I would like to take a moment to express my heartfelt gratitude to Professor CRS and Professor Ganesh Pai for their encouragement and support throughout my career. Thank you, sir. And my contribution. Wanting to give back to the community and share the knowledge, I joined a group of lovely friends, Dr. Malvika, Dr. Neena, and Dr. Mutta, and started training workshops and named it Indian Academy of Aesthetic Dermatology. We were way ahead of times. We ran the course successfully for a few years, and I had the opportunity to host 2 such workshops in Chennai, and you can see prominent figures there. You can see Dr. Vidya, you can see Dr. Meera James, whom we are missing today, and Dr. Tarun Mittal, Dr. Aarti. And then in 2009, you can see Dr. Kali Suren, and you can see Dr. Krishnakant, who are all professors now. Now, I was determined to continue my efforts in educating the younger generation. I started a postdoctoral fellowship in aesthetic dermatology in my center, and this is attached to MJAD Medical University, and this is a 1-year course for post-MD and DNB dermatology candidates only, as this provides an opportunity to learn dermatosurgery while pursuing their postgraduate dermatology course. Now, challenges. Actually, there was much less acceptance when I really started off. When I first ventured into dermatosurgery, it felt like stepping into forbidden territory. I was looked up as an alien in this field, and there was less acceptance from patients as well as colleagues. And I was actually practicing in just a single room, but I had to move on to a bigger space and buy more devices. Now, adversity in dermatosurgery often comes in the form of unrealistic patient expectations as well as unexpected outcomes, which is the norm. And the power of social media, it actually creates unhealthy competition amongst ourselves. And with Google misleading patients with its false 5-star ratings for dermatologists. And to add to it, we have illegitimate competitors like the beauticians, the dentists, and the plastic surgeons. And thanks to IDAC, who has come to our rescue, and I hope all of us will join hands with them to fight quackery. So in such situations, while facing challenges and skepticism, I was always reminded of the golden words of Professor Thambaya: the glory of tomorrow is rooted in the drudgery of today. So the best practice is to have both cosmetic dermatology as well as medical dermatology practice, because medical and surgical dermatology should thrive in the symbiotic relationship. As Walter B. Shelley said, knowing the diagnosis is good, knowing the cause is better, and knowing the cure is best. And most often we know that dermatosurgery has the answer. Now, what is the future of dermatology for the youngsters? The future for solution for disease or desired dermatology is comprehensive skincare. Trends and innovations will continue to appear by leaps and bounds. AI will be the future. This is one of my patients who had brought her face with her AI app, and she told me that she wants on the forehead and fillers in other areas as shown in the thing, because she had the before and after of how she would look in that AI app. So this is what it's going to be in the future. So I think all of us have to be geared up to face these patients. And days are not far off before when MCH course in dermatology will happen. So stay updated. My humble suggestions: post-graduation courses should include dermatology training in their medical curriculum so that they do not turn to bodies like the Ilamed for qualification. And they should be taught not to call themselves cosmetologists, to surgeons, interventional cardiologists, or procedural dermatologists. And hardcore clinical dermatologists, please refer cases to the needy patients to the respective dermatosurgeons, otherwise they are going to quacks and beauticians, and we need to help our dermatosurgeons. And ethical practice always. Let not dermatosurgery be a hammer for which everything is a nail. And we need to have a mindset to shift from disease or medical dermatology to desire or surgical dermatology. We need to adapt to the times. And if you see, there's a book on surgery of the skin on procedural dermatology decades ago. And still, most of them are not able to embrace or encourage our postgraduate students. And this dermatosurgery is a catalyst change that has occurred in dermatology. And as Charles Darwin says, it is not the strongest of the species that survives, nor the most intelligent that survives. It is the one that is adaptable to change. So let's all change for the better. A big thank you all for listening. I dedicate this oration to all my teachers, family, staff, and above all my patients, without whom this would have